Welcome to another episode of Over This Should podcast, where we ditch the expectations and shoulds that society's placed on our life or we've put on our lives ourselves. I am beyond excited to introduce you to today's guest. We have Dr. Maria Sophocles on the show. She's internationally recognized gynecologist and a passionate advocate for women's health. She has nearly 3 decades of experience. She combines her extensive medical expertise with a personalized approach to patient care. But in addition to numerous professional accolades, she also has a successful and brilliant TED Talk out there, which we'll talk about. And on her resume, she's adding author. She publishes her first book in December. So join us as we dive into her mission to advance gender equity, specifically in women's health. And also go ahead and grab your favorite beverage because I have a feeling we're going to get into some juicy topics. Welcome to the show today, Dr. Sophocles.
Thank you. It is so great to be here. I love talking about all this stuff, as you know.
So the listeners know, I had the distinct pleasure of being in the audience when you did your TED Talk. And I am nerding out a little in case folks are wondering. This is a really exciting moment for me because you took the stage, and one of the first things out of your mouth was a conversation you were having with a patient, and she said, "My vagina has betrayed me." I
Exactly.
never thought I would hear that on stage, let alone that I was like, oh, other people feel this way? Talk us through the bedroom gap and how you coined that phrase and what it means.
Sure. So the bedroom gap is a term that I coined several years ago, really to myself, and then shared it with patients. And now it'll be the title of the book coming out and a film documentary, which I think will have a different title, but about the same thing. And it really refers to the difference in sexual expectations, sexual abilities that happens throughout life, but that gets really pronounced in midlife, in perimenopause, menopause, and in our older years between men and women. There are bedroom gaps between gay couples. There are bedroom gaps of all sorts. There are many of them, but the main one that I refer to has to do with the fact that men largely maintain a lot of their sexual desire throughout their life, whereas women's sexual interest and desire tends to drop off in midlife, combined with physical changes that happen, usually due to menopause and perimenopause. And this awkward difference and shift that happens to couples and what we can do about it. So that's kind of what the bedroom gap means as a title. Oprah Winfrey, thank you, Oprah, was very cute to pick up the term and deem it official. So once Oprah deems it's official, it's official. You can Google bedroom gap and it'll say a term coined by Dr. Maria Sophocles. And she made it her word of the week. And I think she said it's because she realizes how universal it is to have these changes happen around midlife between men and women, and how we really need to shout it out, to call it out, to name it, and to fix it. And the good news, if we just cut to the end of the story, the good news is that the bedroom gap is closable or fixable,
Mhm.
and that we as women need to advocate for ourselves and learn about our bodies and be able to say clearly and comfortably to a clinician, I need help with this. And if that clinician isn't well trained or isn't comfortable, that's okay. You need to be able to go elsewhere. So that's something, we can talk about, is how you find someone to help you with this. And then the bedroom gap is also part and parcel, really, about communication too. How can you communicate your needs and wants, not just to a girlfriend or a clinician, but to your partner, which is harder than you might think to do.
It's true. It's one of the reasons this conversation is so important right now is I was telling you before we started recording, one of the things I tell my clients is I want to help you gain the clarity, confidence, and communication skills to say what you need to say and ask for what you want from the boardroom to the bedroom. So I think about my own life timeline and a lot of women who run in the circle with me. In my 20s, some folks in their early 30s, you're having babies, you're establishing this new life. Having children changes your sex drive, You're exhausted, right? And I need to ask your help with this because I had babies in my 20s, three little ones all through my 20s, and I kept seeing this when you hit 40, you become a cougar and you just want to have sex all the time. And listen, I'm in my 40s and that hasn't happened yet. So what is going on with the hormones?
What is wrong with me?
What's wrong with
First of
me?
all, nothing's wrong with you. You're not broken. Um, Hormones, obviously a real thing, right? They're made in your ovaries, two little organs the size of an almond each, but they are so powerful. I mean, the ovaries are so powerful in that they make primarily three hormones: estrogen, progesterone, testosterone. I don't want to make this podcast into a science lecture, but it's really important that women understand that we're all born with all of those hormones, but they do change amounts during the course of our lives. For existence in puberty, we have male and females all have these hormones. Like we have testosterone, men have estrogen. Many people don't realize that. But then at puberty, the male testosterone level goes up tenfold. And that's why, teenage boys like just think about sex all the time and all of that. Um, why, what happens, this is stating the obvious, but what happens is in our mid 30s, those hormones can begin to fluctuate a little bit, and especially into the 40s. And this is the sort of decade we call perimenopause. And it's an emotional roller coaster. For some women, it's no big deal. For others, it's anxiety, moodiness, teariness, rage, horniness, or lack of libido. I mean, it has a lot of different presentations. And this is where it's frustrating is women kind of put their hands up and go, what the, no one told me this was going to happen, because most mothers don't even talk to us about it. And it's so different. Just because your girlfriend had no problems doesn't mean you'll have no problems, or your mom had no problems, So that's what's also frustrating is it's not super predictable. It's very variable in terms of what happens and how it happens. In terms of sex drive, when we look at sex drive, um, many women lose their sex drive after menopause. This is probably because not only does the estrogen drop, but the testosterone drops. But it also has to do with where we are in our lives, right? Your sex drive is not only a hormonal input, it has to do with how you feel about yourself, how you
Mm-hmm.
identify your with yourself as a sexual being. Many women were actually taught that it's not ladylike to think about sex. It's not appropriate to masturbate. It's not even appropriate to talk about sex with other people. These sound like really prudish kind of concepts, but I have seen close to 100,000 women in the last 30 years. So I can tell you that these ideas are alive and well. And they're not shared by a lot of men. Men have no problem admitting that they masturbate. Society expects them to. They have no problem admitting that they enjoy sex. Society loves it when men are robust and sexual. But when
Mm-hmm.
women are sort of lusty or craving sex, society has mixed messages for us, right? And some TikTok channels were kind of cool and hip and badass, but in others, we'd be a whore or a slut. So women are pretty conflicted about their own sexuality in a very broad way. Why do you have a sudden sex drive in your 40s, or your friend does and you don't? Depends not just on hormonally what's going on, but on your own relationship with yourself, with your own body, with understanding your anatomy, with your partner. Are you married, single, divorced, widowed, transitioning? Where are you? Do you have children? Do they sleep in the bed with you? Do you have a dog? Is your bedroom set up for sex? There's so many different things. I was so lucky to work with Dr. Ruth Westheimer, and she was the one who first taught me about the importance of the bedroom itself and how you set it up for sex. In other words, it should be a kind of the right temperature. There shouldn't be any distractions. You don't want any screens in there. You want to make sure you come into the bedroom pleased with yourself and your relationship. Like so many things that we take for granted. And we get into bed exhausted, thinking about our kids' failing calculus grade and our mom's recent bad cardiac stress test and, you know, 800 other things, something at work. And we're expected to suddenly turn all that off and want to be a cougar, right? That's a lot. It's a lot to ask. But I do in my book and in a lot of my talks, I do help women really learn how to enjoy sex and how to bring a sort of mindfulness into their own lives so that they can clear their head. Because I have learned over the years that it is not just a prescription from a doctor or even here's some hormones and you'll be fine. It's really about um, giving yourself permission to see sex as your right, that sex is not just for male pleasure or conception. These are really old messages that we've been given that we have to shed, and it's hard. It's really hard.
I agree. So mindset is critically important, and then creating an environment. So almost making your bedroom the sanctuary. And from the mindset piece, I agree with you. When I don't feel good with my body and how I look, I don't want to be touched because I'm
Right.
not comfortable with it. So maybe even something as subtle as then finding lingerie or a negligee that makes you feel good. And you're covered up, but you still feel sexy in that moment where you're feeling a little setback with your body. I like,
Exactly.
okay. And I think about like yoga class, right? You go to yoga and they say, leave all your junk outside of the yoga door. You're here to relax and be in tune with your body. It's almost like maybe the bedroom's the same way. Like, let's leave the junk outside of the bedroom. We'll have this conversation at the kitchen table, but the
Yep.
bedroom is for the enjoyment of one another.
And I think, some couples or women, I'm also do sex therapy. So many women will come to me and they're actually pretty far gone where they say, I haven't had sex in 2 years or 12 years, whatever. And I'm otherwise happily married, but it's this big glaring elephant in the room. How do I re-begin? How do I take that
Mm.
first step back into the cold water? And I often will have them just shed the preconceived notion of, well, I've got to jump in bed, be naked, and have penetrative sex. That's like saying get in a car and go to 100 miles an hour right away. I think it's okay to redefine sex for yourself or to baby step back towards it. Maybe it's something like you have a cuddle date with your partner, which is just G rated, and you guys just sit in a comfy chair together and you don't talk about taxes or children or any of the practical topics, no politics, of course. And you giggle and you reminisce, and there's touching going on and intimacy happening, but
Mm.
without the expectation of, penis and vagina and orgasm. Like, I think if we can remove some of those objective sexual milestones that we define as did you have sex, I think it frees us a little to just enjoy
Mm.
intimacy really, and the joy of being with someone and the joy of physical touch. And then you can start to remember, oh yeah, I love the smell of his shampoo, or I love how my head feels on his chest, or I love how soft that skin is between the wrist and the elbow. Little things like that, even if you don't articulate them, and you can sort of rebuild in a G-rated way your attraction. And then from that, you can go to PG to R to X kind of thing. But I think for some women, what's so hard is to think that what's expected of them is suddenly, penis and vagina, penetrative sex, orgasm. And orgasms are not everybody's cup of tea. Some women never have one. Some women can only have it in certain positions. Most women can only orgasm from clitoral stimulation. They cannot orgasm from penile penetration. I know this isn't new news, but there's always some listeners who are like, what? Wait, what? And that is such a relief because they felt so broken because of course the Hollywood stereotype is some woman in a car who's moaning and screaming in 3 seconds. And it's just we really have been fed such images that were made by male directors and male scriptwriters, and it's done us a disservice, I think, Pam.
So that was beautiful about the intimacy without penetration, just kind of rebuilding that. And I love what you said about we're sold this bill of goods about what sex looks like and how you orgasm. One of my favorite movies is The Holiday with Kate Winslet and Cameron Diaz. And I can't remember every line or scene of that movie, but one that sticks out to me is when they're going to have intimacy and she's like, foreplay is overrated. And they just jump right into it. And I thought, like, I want to be that woman. I want to be a woman who could drink beer without feeling sick and thinks foreplay is overrated because I need the warm up. Please. So I'm curious. So that's for the women who haven't had sex, like recreating the sensitivity and intimacy in a relationship is important. What about the woman who's been in a relationship and she deserves an Academy Award because she's been faking it for so long? How does she call back that she hasn't had an orgasm in a while and there's something else she needs? Where does that person start?
Oh, that is such a great question. Thank you. Because you're right. That's the different. And faking it is completely common. I mean, very common. By the way, men fake it too. And you would think men can't because they're ejaculating and we would know. But it turns out there's actually a decent proportion of men who also feel pressure to show their partners that they're enjoying sex. And so there's faking going on there too. Just FYI. But I think for that woman, it's really about communication. And the hardest conversation is the very first one. And after that, you've broken a little chip, you've chipped the ice open and you can go. And the easiest way I tell patients to begin a conversation is on a walk. Why? Because you're both facing forward and
Mhm.
you would think looking into each other's eyes is so important. The reason that's so hard is you can read each other's reactions. And it might be really bad if you start a conversation and you get a facial expression of denial, anger, someone's pissed off or someone's surprised. Like it's going to shut down your own ability to keep going with the conversation. So go for a walk. And then you can bring it always from the positive. So you want to say, when we were having sex last night or last week or last month or on vacation in Bermuda, I really, really enjoyed myself. And one of the reasons I really enjoyed myself, maybe because it was quiet, no one was around, but I just felt like I could really be myself. And I realized how important that is for me. And so I think that that's going to be something I carry forward for my own sexual pleasure because that gives me so much joy, that authenticity. And I feel like I can be authentic with you. And you know what? I realize I haven't always been that with you or even other partners. And I think I just felt this maybe societal pressure to kind of amplify my response, but say once I really feel that pleasure, I think I just want to be into that pleasure and own my pleasure. And if orgasm sounds or something comes out, that's great. It'll be authentic. And if they don't, that's great too. So something like that. And I will sometimes role play with my patients so that they can hear themselves saying it out loud. But if you don't have a Maria Sophocles to role play with, you can certainly do it in the mirror or find a good friend that you can giggle with and say it. But a walk's always a wonderful way because you're kind of facing forward, just like a therapist, the old therapist patient on the couch, right? And the patient doesn't have to look at the therapist, so they can just sort of free form share their thoughts.
Hmm. I love that. And science says that women like to communicate face to face, but men prefer shoulder to shoulder or side by
Okay.
side because it takes away that defensive mechanism for them. So even
Yeah.
when I'm having a hard conversation with my husband, I usually do it in a car ride. Not because I want him to run us off a bridge, but because we're side by side, he's looking forward, he's focused on that, and we can also deconstruct something that's going on with our house or with our family or what have you. Get
I
out of your
love it.
Yeah, okay. Get out into nature, take a walk, have that conversation. And then I love the the commonality between me working with corporate women because I would say something similar. When you want to ask for something at work, a promotion or a pay raise, get clear about what you want and then practice the heck out of it. Get into the mirror, get it with a trusted friend group or your network and start advocating, practicing, speaking up. Then you're really comfortable when you get put into the situation where you get to ask for what you want.
Yeah. Yes, it's not this first time coming out of your mouth, awkward stuttering, because you do want to say it, at least from a sexual standpoint, with empathy for how the other person may be receiving this news, knowing that I think a lot of men are very defensive. I think they have a lot of fear about not performing well as lovers. And think about it from their standpoint, how hard it must be to have your sexual debut, usually in your teens. You mostly have learned this from porn or guy friends or something. It's not like and sex ed in our country does not talk about sexual pleasure. We talk about putting condoms on bananas. We talk about not getting pregnant or getting STIs. It's all from a lens of fear instead of pleasure. So they have not been equipped with the right tools for talking about it. We don't do breakout sessions in eighth grade sex ed. And, the teenage boys say to the teenage girls, what gives you pleasure? I mean, I would faint if I found a sex ed program like that. I would faint with joy. But so I think, and then they go from that eventually into being married and wanting to please, or married or in a long-term relationship, wanting to please a partner, but it's not customary to kind of come at it from a female pleasure standpoint. You know who does it much better than heterosexual couples? Gay couples. All my gay patients and all my male friends in gay relationships are very comfortable regularly with a new partner saying, what turns you on? What's good for you? Is this good for you? Do you like it when I do this? And I think if heterosexual couples could get a little more comfortable with that, and some are, so it's not a ubiquitous thing, but I think we as women who have been programmed to think of sex as for male pleasure and ejaculation, that's a goal. We have to rewind that film
Yeah.
and almost pretend we're in a sex ed class for 35 or 40-year-olds and practice saying, like, you know what, and again, in a kind, empathic way, coming from a space of sort of mutual enjoyment, is what I really loved was when you did this, or when we did this, or I loved doing this to you. Did that feel good for you? And again, maybe it's in a car on a walk. We can get the comfort to say that and talk like that.
I think that's really well said. And to your point, one of the reasons your TED Talk struck me out of the gate was not only your opening sentence, which was shock and awe, and I was like, tell me more, but also I don't really hear women talk so openly about women's health, vaginal dryness. It's okay to ask for what you want. You gave every listener permission for that. And it's not that we need a permission slip from somebody else, but sometimes we forget that that's an inherent right that we have to ask for
Right.
the same pleasure that we're taught men should have. We grow up seeing that. We grow up being told to be a good girl and to be on your best behavior and to not let your bra strap show in school
Right.
because you have
Right.
all these rules that are put on you. And it's really hard to rewind that tape and decondition that training.
So we're taught to be ladylike and don't let your bra strap show, but we're also taught that in bed you should be moaning and screaming and having orgasms from penile penetration. And I think both of those need to get tossed in the trash. Not that there's anything wrong with being feminine or loving being a woman. I love my gender and I'm happy. And I'm also totally in support of non-binary expression. Whatever makes you feel like this is the you that you were meant to be is what you should be. Since we're talking about sex and porn, I think porn, the word, has such a crappy connotation of like cheesy music, male view, the male gaze. And that
Mhm.
is how most of the industry still exists. But no, please, listeners, know that there is an industry by women for women. And the industry, Erica Lust, Lust, for example, makes female forward porn movies, and she's done so, and she has a phenomenal TED Talk. So Erica Lust, her TED Talk is definitely worth hearing about. But also there's something called audio porn. Audio porn are stories, and they're usually apps, and you can put your headphones on and scroll on your phone and find, if your thing is the professor and the student relationship, or the guy with flowing blonde hair on horseback relationship, or whatever your version of what a fantasy might be, you can find it. And we know that women's brains love to read or hear erotic imagery more than see it, whereas the male brain loves to see erotic imagery. But for women, it's more sort of palatable if they put headphones on and lay in bed and just listen to someone tell them a story that's for them erotic. Your brain will store this. Think of it like a savings account. And if you just keep adding to that savings account, it's almost like your own little mini sex therapy or desire enhancing move, and you will be a little more interested in the sex that you have. So don't forget to bring imagery, whether it's visual, auditory, or written, into your brain. It's no side effects, no prescription necessary.
I love that. And what's so interesting there is how many times I've heard my friend's husband say, she's ordering another spicy book or she's reading this new series and complain about it. And my response is always the
What?
same. Aren't you lucky? Because you're the
Yes,
beneficiary of everything that formulates in her brain and what she wants to try. So aren't you the lucky one?
that's right. I call these audio porn sites, I call them oral sex, AURAL, oral sex, because you're listening to all these kind of wonderful ideas and images, and there is something to novelty in sex too. The brain, we all have different needs for novelty. Some people really like the same thing over and over their whole life, but some people, they have higher sort of, I call them dopamine needs, right? And people like that are at risk for straying, having an affair, something like that. So if you have a partner like that, you should be thinking, how can I keep my sex life a little bit creative or new? And it doesn't mean you have to swing from a chandelier, in leather and whips and whatever, but it does mean you could have a little bit of surprise or try different things or listen to some of these stories on these apps. Like Quinn is a good app, and take some ideas and either float them with your partner or surprise or something like that. There are people that really, especially in long-term relationships, they really start to need something new or fresh.
Yeah, that makes total sense to me. Okay, in your TED Talk, you talked about vaginal dryness
Yeah.
and how that and discomfort can really put a damper on intimacy. What innovative treatments are available beyond your traditional hormone therapies?
Yep. So several. So vaginal dryness or vaginal atrophy has a bigger, longer scientific name, GSM, genitourinary syndrome of menopause. And we bothered to make this big new name because vaginal dryness is a proxy for dryness in all the genital tract, the bladder, the urethra, the vulva, the vagina. It all ends up taking a hit. But vaginal dryness is particularly annoying because it makes sex painful. You need moisture to have comfortable sex, and you need elasticity. So it means you need blood vessels and collagen. And both of those things go away with the lack of estrogen. So the first thing invented for it was vaginal estrogen, and that's still probably the best thing, right? Because you put estrogen safely in the vagina and it will regenerate cells. But there are some women who won't use it or who are afraid of it. And for those women, there are some alternatives. So, alternative number one is an FDA approved pill called Osphena, Osphena. Osphena was invented for osteoporosis, but it turns out it also helps the bladder and vagina to generate estrogen within and make new cells. It is not a hormone. It is a very safe medication. You take it once a day with food, and you are getting free osteoporosis prevention, whether you want it or not. Because the FDA said you can either be marketed as an osteoporosis preventer or a vaginal dryness fixer. So they went with the GYN indication, but the benefits on the bone are still there. So that's kind of interesting, right, to know about that. The second option that is non hormonal is to have little tiny injuries made in the vagina, teeny, much like doing a facial laser or microneedling. You've heard, those derm procedures. They work by making tiny little injuries in the skin, and your body heals from those by making beautiful new cells and collagen in the skin, and wrinkles are more faint, and those absolutely really work. Someone like Angelina Jolie has gorgeous skin and gorgeous facial features, but most Hollywood stars like her use that kind of injure and repair method through their dermatologists and plastic surgeons. So in 2008, two doctors invented the same thing for the vagina in Italy, a dermatologist and urologist. And I was very lucky to be really like one of the first American physicians to know about it. I was living in Italy. So when it got FDA approval, some of the very first machines came to my office and we still use them. They're a little probe, like the size of my finger, goes into the
Mhm.
vagina. It's absolutely painless. It's really risk-free. There, you can't, if it's done correctly, you literally cannot hurt anybody with this. And the laser makes little tiny, tiny micro dots. You get up, you walk out of the office, and then you begin to make new collagen and new blood vessels. So you have more comfort, more elasticity, and more moisture. And these are important things. So the last thing that women can use for vaginal dryness is something called a vaginal moisturizer. This is not a hormone. This is not prescription. These are usually suppositories vaginally a couple of times a week. They have hyaluronic acid as a main ingredient, as the active ingredient. Hyaluronic acid is wonderful in that it pulls moisture from behind the vaginal walls into the vagina. It robs Peter to pay Paul. It doesn't make its own new cells. It doesn't fix anything in terms of creating new cells to or estrogen or anything, but it will make the vagina feel more moist. So for women who can't use vaginal estrogen or won't use vaginal estrogen, it's certainly an option. And there are several companies that make hyaluronic acid containing vaginal moisturizers. Bonafide is one company. Fem Pharma, Femme, Pharma, Fem Pharma makes one. The brand is called Mia Vita. That's excellent, wonderful, high quality. And so, yeah, we have options. Lube, of course, right? Um,
Always.
yeah. And lube is something else. We have to take the shame and stigma away from that, right? That is not just for old people. That is not just for people who have severe dryness. That's for anyone. Studies show that any woman who uses lube, even if they are having good sex, tends to report that their sex gets even better. So good to know.
Yeah. Yeah, I agree with that. At one point, I had a friend say, like, bathe in it, like, just basically bathe in it, and it just makes a huge difference. So, again, having other women tell you and talk to you about things is really important and helpful. Speaking
For
of
sure.
that, I also heard another woman talk about getting an injection, like a filler. Is that a thing that's real, and does it help?
Yeah, I think we better tread cautiously with that. Okay,
Okay.
there are health spas and plastic surgery spas are sort of jumping in this GYN market. Everything is for profit, so remember that when something is
Mhm.
purely for profit, you've got to be a little skeptical. Getting O shots, getting shots of fillers and versions of Botox down there does not have any reliable scientific data showing improvements in pleasure or orgasm. They all quote that they have scientific data, but I'm always asked to be a consultant for companies like this. And I am really skeptical about them being consistently beneficial, and they're really expensive, really expensive. Before I would spend $1,500 or $2,000 to have someone inject something near my clitoris, I would get a really good sex toy. I would download the Quinn app and I would improve my own pleasure myself. I would go for a walk with my partner and work on that. I mean, all the things you and I just talked about are much safer, much easier, much less expensive. So I would say buyer beware of those things.
Thank you. That's really helpful. And you, okay, so we're really focused on sexual health right now, which is awesome. But I
Mhm.
think you talk about health pillars. So
Yeah.
beyond the sex piece, what are the health pillars that women should be paying attention to?
Yeah, so my own virtual practice has women from all around the country and lots of other countries. And so what I've found in 30 years of doing this is that the women who come to me for help with perimenopause and menopause usually come for those symptoms, but then they want a bigger picture. They want me to look at the whole next third of their life and say, how can I live that life in the healthiest way? How can I have not just longevity, but health span, meaning how can I stay healthy for as long as I can? Because we all want to be that 75 or 80-year-old woman that you see sometimes skiing or on a stand-up
Yes.
paddleboard, and you're like, wow, you're 80, you're amazing, And yes, there is something to genes. I mean, my father-in-law is 87 and weighs the same that he weighed in college, is and on no medications and sharp as a tack. That the man just has great genes. But he doesn't smoke, he doesn't really drink, and he keeps his weight in check, and he's very, very connected in his community and in his society, and he feels needed. So I think this gets back to those pillars. So, four pillars of health that we talk about are sort of four things that if you pay attention to now, whether you're 30, 40, 50, or 60, and say, I'm going to make sure these things are in good shape, you're going to be more likely to be a healthy, with it, smart, vibrant 70, 80, 90-year old. Okay. So, what are the pillars? Well, sleep sounds so overrated. It's something we all do every night, but you can sleep well or you can sleep poorly. You can be abusive with your sleep and pull all nighters because you're partying or because you think you have work that couldn't possibly be good unless you pull an all nighter. You could get an aura ring and see whether your sleep is actually deep sleep or restless sleep. You may have sleep apnea, and that's disturbed sleep. So if you're someone who snores or you have a partner who snores, you may want to have them get evaluated by a sleep specialist, because sleep apnea is not just snoring, it's interfering with good quality sleep. So you and I could do a whole podcast thing on sleep and how to get great sleep. And I can recommend books and programs and all kinds of stuff. So sleep is one pillar. We want to have the right number of hours and the right quality. Movement or exercise. Again, not a rocket science thing, but so, so important now, whatever age you are now, to look at your life and say, am I moving enough? Or am I just, well, I'm in law school, I can't now, but I'll get to that in 2 years. When I got to med school, I looked around and I saw all these stressed out med students, studying from sun up till sundown and miserable and snacking on Funyuns and Rice Krispie treats and drinking Cokes. And I just thought, I'm only 5'2". If I start eating and drinking this stuff, I'm going to be 300 pounds, and I'm a little too vain to be 300 pounds. And I want to be healthy in my brain and in my body. And so I started just making sure I went for a run or to a gym every day, an hour before class started. And yeah, it was hard to get up earlier, but it made me feel so in control. And so I do think that movement and exercise has physical benefit, but also emotional and confidence benefit. So when you're telling people to negotiate for what they want, I think part of their ability to feel that is to feel strong in their head and in their heart and in their body. So sleep, exercise, and movement. The national recommendation, by the way, is now 300 minutes of moderate exercise a week for women. That's a lot. That's 60 minutes, 5 days a week. So, if you're fitting in a 15-minute workout once a week, you're not really moving as much as human beings were probably meant to move. Um, and we need this as women for bone health. We absolutely, absolutely need to know that we begin losing bone density at age 35. So while you may think of frailty and hip fractures and osteoporosis as a disease of 70 and 80-year-old women, it's beginning at 35. It's only severe then. So again, what you do now, you're putting health in a savings account so that at 70 or 80, you're on the ski slopes or the stand-up paddleboard. So sleep, movement, nutrition, of course. Women as we age need fewer carbs and more protein. And this isn't how the American diet usually works, right? We have tons of carbs in everything. And it takes work to actually think about how much protein do I need and how do I get it. So you very well may not be getting the protein you need. Why do we need protein? To build muscle mass. This brings us back to hormones. When we don't have the same hormonal milieu as we did as younger women, it is harder to build and maintain muscle mass, which means we instead have fat, which stinks. So, so sleep, movement or exercise, nutrition. And the fourth pillar is community and social engagement. Um, and this is what sustains us through depression, through hard times, through divorce, through loss of parents, through all kinds of the vicissitudes of life. It's one of my favorite words. And certainly into old age, which can be a very lonely time. So, again, look at yourself now and build whatever your community is. Take the time to reach out to that friend that you really like, but you only talk to once a year, and see if you could maybe have a quarterly call. Um, Take time and make the effort to find a walking buddy, because you'll talk and you'll move. So simple little things like that, I think, pay big dividends when we're older.
I love that. Habit stacking. Okay, so sleep 7 to 8 hours a night. Is that the average
Yeah,
number?
those are easy numbers to remember. Yep, yep.
Movements 300 minutes a week. But how about nutrition and protein? How should we be calculating our protein needs?
Well, the movement, that's the quickie, that 300 minutes a week, but what you do matters too. So while I'm so old, I grew up like with Jane Fonda doing aerobics and all that stuff and the gym fix and running. So I was a runner for 30 years. Great. But as I've become menopausal, my needs are changing to strength training. So I and women in their 50s and older need to shift from aerobic exercise into more strength training. And again, if you need more guidance on this, I know, Pam, you can get people in touch with me. You can reach out to me through you, right? And the protein is also related to that need for muscle. So protein, you should aim for 1 gram of protein per ideal body weight. So if your ideal body weight is, and this gets hard because if your ideal body weight is much over 120 or 130, it's really hard to get that much protein in a day, but you can at least aim for 100 and go from there. So 100 grams of protein. um, Look at what you eat. Take a little, there's something called a chronometer. That's an app, a free app. You can use that to calculate things, or you can just look at the back of what you're eating, a cottage cheese or an egg or a chicken breast. A chicken breast and half a cup of cottage cheese both have maybe 30 to 40 grams of protein. So a couple of smart choices throughout the day can get you pretty close to 100. And then many people, myself included, will try to make a sort of smoothie with fruit and veg and a couple scoops of pea protein to try to get over that 100. It really facilitates the building of lean muscle mass, and I'm not talking about big, giant, ugly, muscles. I'm talking about lean muscle mass, which helps us with balance, helps us actually reduce the fat that we don't want, and helps us have tone, and it's attractive.
So you have been an absolute trailblazer when it comes to women's health. What personal experiences have you had that have shaped this journey into this field for you?
I got into practice and I was so confident. Oh my gosh, I am the best doctor. I'm going to do a great job for everyone. And I was so like, I'm good at delivering babies and surgery. And then the 50-plus-year-old women would come in and they would say, I have frozen shoulder and palpitations and my hair's falling out and I'm crying all the time. And because I had had no menopause training, shocking, but true, I thought, oh, okay, I'll send you to a psychiatrist, a neurologist, an orthopedic surgeon, and a dermatologist. And I thought I was doing right by them. And it turned out I was failing them miserably. I was absolutely the worst, and it turned out all the other OBGYNs were doing the same thing. And so I had to teach myself about menopause, and found the North American Menopause Society, which is now just called the Menopause Society. And by the way, you can just go as a non-clinician to menopause.org and put your zip code in, and it will find you someone who has a little certification in menopause and knows a little more. So that's a great way to find a menopause clinician, menopause.org. So maybe 20 years ago, I went there, learned a lot, and was mortified at how little I knew. And then as I aged and my patients aged, they started having different questions. Even the young women had delivered their baby at 28 and now they're 38 and they started having this hormonal chaos. And I, again, was like, I am underprepared to help them. And then the sex thing was sort of a natural segue because as the women aged further into their mid to late 50s, they were really having terrible vaginal dryness. And again, I was not trained to treat any of that, shockingly. And that's also why pioneering the use of the Mona Lisa Touch laser was a really cool thing for me. I felt like I was making a contribution to gynecology that hadn't been there before. And so I actually have gone around the world teaching that technique on 5 different continents to physicians so that other women could use that. So it's largely been an awareness of what was deficient in my own ability to give the care I wanted to give.
Deficient in your own ability, per your words, but also just in how we treat women's health in general. I think what's really interesting in hearing your talk, you talked about the use of Viagra. It's prevalent for men, but what are we doing for women? And so I did
Right.
a little research before the show, and I think it's 3.4 million Viagra prescriptions were issued in 2022. But when I look at what's comparative for women, it's so few. In fact, when I research like sexual support, sexual assistance, all the different ways to look at it for women, it just kept coming up with the contraception. So
I know.
men
I
get to
know.
have an erection and enjoy sex, and our job is to just create a barrier so we don't have babies. It's so flipped upside down. So I wouldn't say it was a deficiency on your part, but rather the
Society
emphasis is
certainly
given
is.
on, yeah, men's pleasure versus women's.
Yeah. So personally, I think it's true. I was super well trained in some things, and that's how most OBGYNs are deficient, by the way. Very, very few OBGYNs got any menopause training and basically no sexual health training. So one of my missions is to help retrain physicians, right? So that they can be more comfortable talking about this. But a much bigger mission is to close the healthcare gap or a tiny fragment of it. I'm certainly not able to close the healthcare gap, but to acknowledge it and to make sure that the world knows that it's not right that 50% of the world's population or 50% of the United States population, meaning all women, all the women, are only getting served by about 7 to 8% of the NIH research budget. So if you look at what the NIH spends on research, there's a small little amount dedicated to women. And within that, most of that is women and children. So they just lump us in with pediatrics. Like, if that isn't the most crazy thing. And then when we look at that tiny little amount, within that, there's so little for menopause, for endometriosis, for things that really affect our pain and suffering in daily lives. So I think actually Jill Biden was one of really the first at that presidential kind of level to really push for funding. And Maria Shriver is certainly very behind this too. And so now there is a bit of an outcry and a rallying cry that we need more funding for women only process medical issues. For women prefer more common medical things like Alzheimer's. Many more women get Alzheimer's than men. Why? And for women, different diseases where men and women get them, but they present differently in women, like cardiovascular disease. So all these things need much more research and study. And as 50% of the population, I think we deserve it. I think we deserve it.
I agree.
I'd love to talk about Viagra itself if you want to, because
Let's do it.
well, Viagra is a crazy story because and this is such a good chapter in my book. I hope you'll read it. It's really good because we go into the history of how Viagra happened. Viagra was a medication made for blood pressure, but then they realized as a side effect, oh my God, everyone got hard-ons. So they quickly realized, oh my God, this could be a blockbuster, shifted gears and said, let's make it like the first, erectile dysfunction thing. Only they didn't call it erectile dysfunction then, they called it impotence. And that was such a shameful word. So
Yeah.
they hired this phenomenal marketing team who hired Dr. Irwin Goldstein, who was someone I know and respect, to recreate impotence as erectile dysfunction. It's not your fault. It's not shameful. It's just this little um, issue with muscles and nervous systems, and take this pill and you'll be cured. And they hired Bob Dole to do these ads, and it exploded. And the FDA approved it right away. Like, oh, here's a small study, nobody died, you're good, right? So this was rushed through like the COVID vaccine. Only, and in both cases, that was fine, right? It helped people. But the parallel started maybe 15 years ago or so, when someone had an idea for a medication for female desire, because lack of desire is the number one most common sexual dysfunction in women. So this company had this medication. The FDA wouldn't pass it, wouldn't pass it. Finally, a small little company took it on, and they got it passed, but only after like 10 years and three tries. And the FDA made the passage so rigorous, so difficult, that the women couldn't even complete the study, and they had to hire men to be the study subjects for a female indication. If that isn't crazy, I don't know what is. They were making the women drink huge amounts of vodka before taking this pill, and the women were passing out and couldn't finish the study. I mean, no one made anyone drink vodka before Viagra, before they took Viagra. So it was this total double standard. And the feminist outcry was, this is because you people at the FDA don't think female desire is a real thing. You think it's just, oh, Pam's too tired. She's got her kids. She's got her job. She should just relax and have some wine. She doesn't need a medication, which is really kind of a slap in the face, right? To sort of say it's all in your head in a way. So that makes for, I think, a very interesting story as a proxy for how women's health in general has not been really valued. And I think that's why the bedroom gap and the story of Viagra are nice illustrations of how far we still have to go in terms of valuing women not as just a version of a man, but as our own unique individual, you know, X species, and that we need drugs for us that have been studied on women, and we need research and development money for us. And the technology industry is finally catching on, but is still way behind in terms of the amount of venture capital funding for women's companies. So sorry to get on my pedestal,
Well,
but it's I'm I'm eager for the future. I'm eager for some equity, some equality.
your book, you've mentioned it a couple times. Is it called Bedroom Gap too?
Yeah, it's going to be called The Bedroom Gap, for sure. But the documentary film, I think we're going to call it Hot, because it's just a fun title. And that way it'll be more than about the bedroom gap. It'll be kind of a look at sexuality for women, and it'll be funny and irreverent and still informative. And yeah, I'm really excited about both. But the book will come out this winter, and it's a lovely look at sex in midlife through the lens of history, through the lens of the biopharma industry, medical education, and just, of course, patient stories. I have so many wonderful, wonderful patients who've shared their ups and downs over the years.
One of the things that's really easy to see on this podcast, if somebody watches your TED Talk, is you take data and science and you have an ability to turn it into a story and partner it with real life experience. And so you're an incredible storyteller. I obviously am going to read your book, and it's probably going to be everybody's Christmas present this year from me. In
Aw.
terms of your documentary, is there anything that the listeners can do to support your documentary?
There is, there is. Thank you so much for asking. And what I'll do is send you the information for basically an angel list or a crowdsourcing kind of campaign, because documentaries are bootstrap affairs. They are nonprofit things. And we want this documentary. It's an all woman production team and this cool woman director. She did a really cool documentary called Periodical about periods and menstruation. She's done one on older women. She's really neat. But we definitely need funding for it. Obviously, if anyone wants to be involved in an advisory capacity, that's always wonderful too. But we need funding to be able to get it started. So I'll send you a link for that and then pass it on because we appreciate any amount, anytime. It's really helpful. Thank you.
No, of course. I'll put the link in the show notes because I have a suspicion that everybody who hears this episode is going to want to know more about you and how they can
Oh,
work with you and how they can support you.
well, my website is a good place to go, mariasophoklesmd.com, because it has info on all of that. And it's also a way to reach me. I'm always getting asked questions about people, from people, and I never mind answering them personally and helping find you someone in the Detroit area or in Milan or wherever you are. And so whatever I can do to help move your needle forward, I'm happy to always be a resource.
I believe this is true because I sent you a picture of me and you together at the
Yep.
TED Talk for Women. And I am in this picture looking like a total crazy person because I was so excited to be able to find you out there in the middle of the TED Talk event. And your husband was there and he was like a bouncer. He's like, "You want to talk to her?" Like making sure I was okay because I know I looked crazy. But you looked at the picture and you're like, "She's a little crazy, but we'll have a conversation." And you gave this a
Well,
chance. And so I really appreciate that. And
you're
I
so
believe
cute. I didn't think you were crazy at all. I was so touched by how warm and vibrant and outgoing you are, which all of your listeners obviously already know.
Thanks.
So
I believe that you genuinely care about women's health, women's equity, making sure people have resources in their hands. But before I let you go, the one last question I ask everybody is, what is your favorite quote these days?
yeah, I love quotations. So I love that you asked that. And I have had, just like people have different favorite songs and favorite jokes, I got a new favorite quote yesterday in the Salt Lake City airport as I flew back from the Sundance Film Festival. And it's by Henry David Thoreau. And it refers to our beauty within and the beauty of the world. So I'm going to read it to you. It is the beauty within us that makes it possible for us to recognize the beauty around us. The question is not what you look at, but what you see. And so I think for me, that's about seeing beauty in yourself and being happy enough internally with yourself and your life that you can look out at what to some people is just a flat backyard, but to me I see the special little trees that I've planted or the way the sun comes down and hits the stone of the patio or whatever. And I try to have that in my life all the time, is to look at the world around me through the lens of beauty and to find beauty anywhere I am. So Henry David Thoreau obviously could say it much more eloquently than I. So I'll send that to you and you can put that up.
Love that. Appreciate the little moments and the little things around you. One day, those little moments are the big things for us. I think that's really beautiful. Thank you so much for being here.
It was so nice to reconnect. Thank you so much.